Hi there, welcome to ComplyPlus Presents. We're back in the chair at last.
Yeah, finally.
After a little sabbatical, let's say, and we're both in the same studio as well. And I'm
Yeah.
joined here in Coventry by Dr Richard Dune.
Thank you, Lewis. It's good. It's good to be back. I can't say I'm excited about the weather, but
No, it's just got colder as you arrived back in
exactly,
the UK as
exactly,
well.
exactly. But look, it's a good break, a combination of work and holiday, and it gets you to think about things differently as well. Of course, I have to keep in touch with what's going on in the UK, and also working with some of our fantastic teams on the other side of the world.
Yeah,
Yeah.
excellent. Yes, a bit of a refresh, and we should be back every week now up until pretty much the end of the year, hopefully. So, yeah, today's topic, we're going to be discussing safeguarding adults in the health and social care sector. The reason this come to light is there have been a few recent safeguarding cases in the news, as there always are, if you know where to look for them. And it has been a common theme with a lot of our clients, even looking at some recently published CQC reports. A lot of failings when you digest and you deep dive into the real reason, they're usually involving safeguarding issues or something to do with safeguarding that maybe a policy hasn't been followed or there's been some sort of misguidance from a member of staff or a service user. So we felt today it's a key subject. It's always an important subject in the news, and we feel it's worth talking about on our platform today. So I wanted to start, Richard, by looking at why does safeguarding matter? You know, we hear the term a lot in mainstream media, but also within the health and social care networks that we're all in. And any of you listeners out there, you'll go to conferences, you'll be banded safeguarding everywhere. So why does it matter?
It's one of those crucial subjects that since the early 2000s really got a lot of focus, and rightly so. So if you look back, the establishment of the Care Quality Commission and, NICE, the National Institute for Health and Care Excellence, there have been many high-profile failings. And by the time we got to the mid 2000s, like 2005, 2006, it became part of the statutory and mandatory training for healthcare workers initially, because I was working in the NHS at the time. Then it spread actually across the adult social care side as well into children's services, because there've been so many high profile failures, and this sort of stage where we are guided a lot by the Care Act, which is 2014. And if you remember, that's after the Mid Staffordshire NHS Foundation Trust scandal.
On the back of that,
Yeah, where a lot of people died needlessly. A lot of people suffered as well. People deteriorated. Some people never recovered. Staff that wanted to whistleblow were hounded out of the trust. And it wasn't the only trust, actually. There were many others that were failing even more. But Mid Staffordshire became anatomy of a scandal, really. Right. So the Care Act talks about safeguarding as being that duty to protect an adult's right to live in safety, free from abuse and neglect. So it's actually in law now, and it puts responsibilities on healthcare and social care workers, as well as organizations. So it applies to anyone who is over 18 when you talk about safeguarding adults, who has care and support needs or is at risk of abuse or neglect and cannot protect themselves. So like you rightly say, we do quite a lot of research, and part of what we do is to review CQC reports.
Yes.
And we looked at the organizations that were rated inadequate in the past year.
Yeah.
And what we saw repeatedly were failings in safeguarding and failings in governance. So if those two regulations, Regulation 13 and Regulation 17, are the most common, and obviously if there are safeguarding failures, then it means that safety is compromised. People are not protected from harm, from abuse, from neglect. And it also affects the care. So Regulation 12 is affected as well. So those are the three main ones that persistently result in organizations either needing improvement or rated inadequate or even put in special measures. Right. So part of it is people, for example, in domiciliary care, the majority of the companies are in domiciliary care, by the way, that are rated inadequate. And people were left without care. So, the calls were missed, although they were billed, but they were not being seen,
But no one
right?
turned up.
And, people were left without food or medication. People were left without changing, getting them changed. Maybe people are incontinent or need to help with toileting. And staff failing to escalate abuse as well. Organizations not reporting, although there are requirements to report to commissioners and the regulators, and governance systems completely collapsing. So these are not isolated mistakes. We are looking at systemic breaches of trust and safety.
Yeah.
So that's how I look at it, and I'm shocked because remember we've been providing training now, statutory and mandatory training, face to face and e-learning, for over 15 years, and it's one of those subjects that we have always emphasized to organizations. But again, if organizations are just ticking boxes, then it's no surprise that systems are failing like this.
Yeah.
Yeah,
I
so-
think that's a really key point to sort of say, yes, you can look at isolated incidents and say, this care worker did this wrong or they did that wrong. But like you say, the bigger picture stuff, the governance side of things, the systems, what protocols are in place.
Yeah.
And that's the point I want to go to now, where we actually look at the systematic review that you and some of the research team have been doing. What were some of those key sort of CQC failings when you did that deep dive into those systematic reviews?
Okay, we need to be careful there, obviously. If you say CQC failings, that could mean something else, right?
Yes.
So failures, although CQC did have a fair share as well. Remember,
Yes.
there were
Before the reform,
they're reforming right now, and they faced a lot of challenges, and that's causes further problems.
Of course it
But
does,
you have
'cause
to
it's
also
transition.
think about COVID. What happened during COVID? There were a lot of safeguarding failings during COVID.
Yes.
Then post-COVID, CQC were overwhelmed.
Yeah.
And even when you look at safeguarding concerns, some organizations, even Birmingham, although it was children's services, it completely collapsed on the weight of safeguarding
Yeah.
concerns.
It was inundated.
And it had to be redone. So when you look at 2023, 2024, staggering numbers, over 615,000 safeguarding concerns were raised in England, and nearly 160,000 and 176,000 were under Section 42 inquiries. So these are serious issues that we're dealing with. Right. And globally, when you look at World Health Organization, they actually say 1 in 6 people age 60 and over experience abuse each year. That's a huge number when you think we have over 7 billion people, and people that are aged 60 and over, they make up probably about nearly 40% of that population.
Yes.
And when you look at countries like the UK and Europe, we have an aging population. So people are living longer.
Yeah.
And the longer they live, the more treatments they need, the more care they need.
Of course,
and then the system just keeps,
Yeah.
perpetuating
more burden
yeah,
to it,
more burden. So institutional abuse in care is also rising. I mean, you just look at CQC reports. Just look even I haven't looked at it in full. Okay, CQC put out their report on inpatient survey, which we're going to scrutinize as well. It's always interesting. Even the state of care reports are always interesting. Persistent failings. Right. And safeguarding, it's not rare. It's a daily occurrence. It doesn't happen in care homes only. It happens in hospitals as well. We saw with
across the
Staffordshire.
board,
It happens in mental health, in learning disabilities. We saw Winterbourne View and many other organizations that ended up on panorama programs on BBC. GP practices, people's own homes as well, family members and their loved ones, that are supposed to be caring for them. So every time the systems fail, whether it's through poor recruitment practices, right, where people don't check DBS, they don't get references, and then people end up working without training. All those things are really sort of making the problem even worse. But the key thing is governance. If you're running any organization, particularly in a highly regulated sector like health and social care, governance is crucial. And people underestimate it. They think if they put policies in place, they tick box to say we've done the training, and they assume that everything, it's okay now, we've done it. Then we'll wait for another date next year to do training, or maybe we review that policy in a year's time. But actually, you have to continuously check what's happening, review your own care plans, review your own care systems, where are failings, and you learn from failings, right? But people try to hide, even though there's now a statutory duty of candor for people to report concerns, and also the duty also on each and every person working in health and social care to escalate concerns. And if they feel that nothing has been done or inadequate action has been taken, then they have a right to whistleblow. They have a right to take it further. So, people experience avoidable harm needlessly.
Yeah.
And that is the crux of the matter. And it boils down to poor governance, poor systems. And even where we have the systems, they're not monitored. We don't stress check them as often as we should. And then we only respond and react to issues rather than actually being prepared and being proactive. So for me, that is really the crux of the matter. Yeah.
Yeah. Excellent. So, in terms of when we look at, say, some of the key questions from CQC, and going back to that systematic review that you and the team have been doing, if we look at, say, safe, is it safe? Is it effective? Is it well led? Is it caring and responsive? What were the main takeaways relating to safeguarding for those sort of 4 key question areas?
Yeah. So it's 5 key questions in total when you look at the CQC questions. But safeguarding falls under safety,
Yeah.
right? Of course, governance as well. Of course, effectiveness, or leadership, all those things
It's
are
related
crucial.
to all of them.
So it's related to all of them, but safety is the key. So if I need care in the community and people miss the visit, I used to work as a district nurse many years ago. And then I worked as an advanced practitioner working in the community as well much later, where you would go in, maybe you want to change a dressing. So that dressing is changed maybe 2 or 3 times a week. So you've got a visit and you get in there and you see older people sitting in cold rooms, and you can, it's just the moment you walk in, you know that somebody is incontinent straight away because of the smell that greets you. The food is just on the side; they haven't even touched it. The cup of tea is gone cold, so it's hard for me to focus then on doing the dressing on the leg before I fix this. Then I have to now raise a concern to try to call that company, the care company. They've missed a visit. They came in for breakfast, and this person actually has not been seen throughout the day.
Yeah.
And I'm arriving at about 5, 6 in the evening to do a routine dressing, but the rest of the care is missing. So it causes a lot of harm. Also, trust as well. Because if companies are being paid to deliver care, then
Then they're not delivering it.
it's neglect and also abuse as well, because you're taking payments and you're not doing what you're supposed to be doing, right? So missed visits was one of the key ones, but also medication, unsafe medication. So if you look at Regulation 12 of safe care and treatment, there are some medications that are quite dangerous. Any medication is dangerous anyway, but some medications that are very high risk, like blood thinners, for example, people that are taking warfarin, or people that are taking epilepsy medicines, or even antihypertensives. If you miss these medications, or if you're given the wrong dose, then that's a problem, right? And it could result in that person deteriorating, maybe even needing hospital care, and maybe even may result in death, right? If you give the wrong
Be as
doses.
serious as
Yeah.
that, yeah.
So also issues around staff failing to recognize and escalate concerns, and organizations failing to escalate concerns as well, right? Then that's then picked up in an audit, whether by the commissioners or by CQC inspectors. Then when you look at effectiveness, Mental Capacity Act not applied correctly, so no capacity assessments, no lawful best interest decisions. Because if somebody lacks capacity, then we act in their best interests to ensure that they get safe and effective care. But sometimes actually people don't seem even to understand the law. Although organizations have ticked the box to say we've done mental capacity training, people cannot apply it in practice. That's a challenge in itself. Then governance under well-led completely collapsed. No governance in place, no systems in place, no audits, no learning, even misleading regulators and commissioners, right? Some organizations were even found to be taking more work that is off the books. So you're providing regulated services, but you're putting them almost as a side job.
Yeah, it's like a side hustle,
Yeah.
almost. Yeah.
Yeah. So then caring and responsiveness, it's a challenge because there's a shortage of care workers, and people then rush through visits because they need to go to the next call. And sometimes also dignity breaches. People are living in undignified environment and they're not being given, when you look at care systems in general, people are very vulnerable because you're providing them very intimate care, right? Washing, dressing, changing, toileting, And it can be done in a dignified way, or it can be done in an undignified way. And obviously, if people are rushing to the next job, they're trying to do things very quickly and get out, right? And also people ignoring complaints, organizations ignoring complaints, not having proper procedures for complaints in place, and even where complaints and concerns are raised, not following their own
Nothing's
policies.
really done about it.
They may have a policy, but they're not following their own policy. And so people, when you look at this, it's masking deeper failures. And they all go down to governance, Regulation 17, right? So for me, the root is leadership. Where leaders fail to prioritize safeguarding, there's then that it's inevitable that harm and neglect occur because the systems are not working properly.
Yeah.
Right. So we could spend a day talking about some of our findings, but what we're doing is we put them in. We did a webinar even with health and social care leaders.
Yes.
A couple of times in the past 2 months, 2 webinars, and we also write a lot of blogs just to remind people and give them tools to use, even audit tools,
really
toolkits that they can
yeah.
use, whether they are our customers or not. We don't mind because we feel that we have a duty actually to support the sector and ensure that people
improve things. Yeah,
exactly.
I think that's a really good, good point. Because with some of these things, because particularly with safeguarding, I think because it relates to so many of the regulations and CQC, the key questions, and really is almost the cornerstone of many health and social care organisations. If you don't get safeguarding right,
everything else fails.
You don't have a business really, yeah. And like you say, it's not just a case of losing a business. You can be prosecuted. People can lose their life. There's a lot of stuff that can happen if it's not handled correctly.
We've dealt with issues where we are working with organizations, and those organizations end up in trouble, and they're bringing you in to put out fires. And we have to be honest with them to say, look, it's not just about putting out this fire. You've got deeper systemic issues that you need to address. And those organizations that are prepared to listen, it's not criticism, it's just merely stating the facts. We have a job to do. And when we work with you, then we provide a report. Those organizations that listening organizations, leaders that are prepared actually to change their viewpoint based on the facts, they tend to be more successful. Remember organizations that were inadequate, we worked with them, some of them became outstanding. A lot of them went from inadequate to good, a few of them to outstanding. And a few organizations that failed to listen, some of them were shut down. You know what I'm talking about here. They disappeared. People were struck off the professional registers, whether it's NMC or HCPC. So it's not just about losing businesses or losing your livelihood. It's what happens, when a care home is closed.
What's the effect?
What's the effect?
The
local authority has to now find alternative places. It's very costly. It's very painful. It's a big decision for families to find a care home for their loved one, right? Yeah. And if that then is cut off completely, there's so many ramifications, and we continue to see them. Sadly, people are not learning, and for me that's concerning. Of course, the majority are providing very good care. They've got good systems in place, but there's a significant number of organizations that are needing improvement, that are inadequate, and it's disproportionate. We should not. There are far too many organizations that are needing improvement. It's not acceptable.
Like you say, based on the amount of people that are needing this level of care now, with some of the other issues you touched on. So, in terms of safeguarding as a topic, what I wanted to sort of look at was some of the principles of safeguarding. Maybe you can inform some of our listeners on some of the key principles with safeguarding.
Yeah, I mean, these are well known. They've been well known since 2014, with the publication of the Care Act. And these are they place legal responsibilities on us as well. So it's about empowerment and prevention, proportionality, and looking at protection of vulnerable people, and partnership, accountability as well on individuals and organizations. So I'll expand on that. So empowering people, it's about supporting people, a lot of them who are vulnerable. So you want to support them to make informed decisions. And remembering that under the Mental Capacity Act, people, as long as they've got capacity, they can make their own decisions.
Make their own decisions, yeah.
Even if those decisions are unwise, all we can do is to advise them, right? I remember some of my days working in the community where people are hoarding, right? You get into the house and think, my God, where do you even start, right? Newspapers, bags of stuff. And there's a risk actually even just walking around the place.
Yeah,
But
several
also
risks.
fire risk.
Fire risk in
You
particular,
know,
yeah.
and then you cannot come and impose, because obviously if you're running an institution, whether it's a hospital or a care facility, you're in control of the building.
Yeah.
So it's your
Have
duty to
rules,
make
yeah.
sure that you remove all the risks. But obviously, if you're working with someone in their own home, you have to work with them within the environment, explain the risks. Some people accept, but some people don't want to let go of their stuff. They've been collecting all the stuff for years.
Yeah.
So you don't take away the right to make an unwise decision. Under the law, they have a right to make an unwise. All of us make unwise decisions many times over in our lives, and nobody stops us from doing that. Yeah, and then prevention is about spotting early signs. Maybe there's potential risk, and maybe self-neglect, maybe even abuse as well. When you're providing care, whether in a hospital or in a GP practice, so spotting those early signs and preventing abuse or harm from happening, right? Then proportionality, there's a tendency to overreact sometimes. People try to play investigators. Sometimes actually there's a perfectly reasonable explanation as to why people are behaving a certain way. Even family members, you might think that maybe they are being abusive, but actually, yeah, it's a matter of stepping back a bit. If you have a concern, you could still raise the concern, but actually, like what happened in Birmingham with the children's services, where people, the culture is that people were so scared, they ended up referring any little concern, and the system ended up collapsing on its own weight. Right? So we need to be proportional. We need to step back, and we have a duty to protect, yes, but actually also we need to avoid overreaction, right? Then when you look at protection, like say you have a duty, but it's about timely intervention when you see that people are at risk. Raising that concern is the first point, because quite often there are so many red flags. When they do, reviews afterwards, you can see so many opportunities that people should have done something.
Yeah, before it got to that point, yeah.
Exactly. Then one of the key things is about partnership working, multi-agency working. So working with all the different agencies, care services, the police, housing, GPs, even the police safe liaison officers now working on safeguarding issues. It's really important that people work together and connect the dots. And like I say again, when you look at reviews, you find that one agency perhaps had some information that was so crucial, and it wasn't passed on to others, and people did not act because they didn't know that there was an issue. But one or two agencies would have had access to information, but they didn't share it. Then accountability goes back again to the individual and organizational accountability. So the duty to set up systems, safeguarding systems in place, make sure that we monitor, we audit, and then also the duty of conduct. It's a statutory duty on top of the duty of care as well. These are legal requirements where there are real consequences actually if we don't act. So even failure to act could be an issue in itself, right? And so, like I said at the beginning, safeguarding is not about ticking a box to say we have a policy, we've done training.
No.
You have to continuously monitor. You have to build a culture of vigilance, openness, and responsiveness, and also not blaming people. It has to be psychologically safe environment for all the different teams that are providing care.
Yeah.
So because quite often people that are in care, receiving care services, there's so many different agencies working with them.
Yeah.
It's about working
Different
together. No
people.
one is more important than others. We're
others.
all working together. We all have responsibilities. Yeah.
Yeah. No, I think that's some really good points there regarding the principles, which, as Richard said, a lot of you will probably already know. But yeah, I think it just goes to emphasise that combination of these things is really, really important. Another area that I was told to ask you about today is terms such as abuse and neglect, and the idea of recognising this. I know you said earlier about preventive action, red flags, and so on, but I think actually defining these categories of abuse and neglect would be quite interesting, because a lot of people ban the terms around, But if I ask one person in a room what they mean by abuse, another person, we've probably all got maybe a slightly different sort of understanding or definition of the word.
Yeah.
So yeah, maybe you could give us some guidance on that.
Yeah. I mean, with abuse, it can be subjective, but quite often, when you're looking at health and social care services, we're looking at our position of power and authority. Because for most of us, actually, when we go into whether it's a dentist or it's a GP or it's any care service, we are trusting that people are going to do the right thing.
Yeah.
Right? We're not expecting our rights to be infringed. Right. And we're also expecting people to act in good faith in accordance with their training, with the ethical framework. So, it's about actually upholding people's rights, right? People's freedoms as well, and ensuring that there is no abuse of that power relationship. Any of us, even for me, when I've been to hospital, I had a couple of operations. Every time you go in there, you're trusting everyone.
Yeah.
Yeah. And you go to sleep, and then when you wake up, you're trusting that they've done a good job.
Yeah.
You're trusting that if something has gone wrong, they're going to tell me, right? So that relationship actually has to be balanced. Quite often we see a lopsided relationship because we're in a position of power where people are trusting us, and then that trust is breached, right? Many times over, and I know some of the cases are controversial, but you look at cases like even as recently Lucy Letby. Although the people, she's challenging the ruling, people are also supporting, but babies died, right? And babies were harmed, right? And, no one, not a single woman or man is going to come into hospital and they're expecting to go home with the baby. But if the baby dies in hospital, deteriorates in hospital, and people that were in a position of trust breach that trust, that is a problem in itself. Right. So we see different types of abuse, like physical abuse, where maybe people end up with bruising, people are pushed and even slapped. Like we've seen in some of the panorama programs, this domestic abuse is rising as well. Where people maybe in husband and wife or whatever relationship people are in, somebody's being abused in that relationship. It could be financial, it could be emotional, it could be multiple types of abuse. You also have sexual abuse, which is a worrying concern because those numbers are rising every year. Psychological, emotional abuse tends to include many other types of abuse as well. Modern slavery, discrimination, institutional abuse. Then when you look at neglect, it's about that duty that we have to say, as a nurse or as a doctor, I've got that duty of care. It's a statutory duty, actually. And any acts that I do or any omissions can actually be perceived as neglect as well if I don't deliver the care that's required.
That's required, yeah.
Right? Or if there's an element of self-neglect, then I don't act on it. Even if that person has capacity to do whatever they want to do, I still need to raise a concern with them to sort of say, oh, by the way, explain the risks, whether it's them not taking their medication, whether it's them living a certain way that is they're taking risks, as long as they have capacity to do that and they are well informed about the risks. But where we don't follow through on our responsibilities, that could be neglect by our acts or even omissions. So it's crucial for health and social care workers to think about that. And even when you look at CQC reports as well, we saw many examples across every type of abuse of adults, right? So unexplained injuries that were ignored, not documented properly, and financial exploitation, direct actually, or even sometimes suspected financial exploitation concerns being dismissed. Sometimes actually it's people who are in positions of authority that are abusing people, financially taking advantage of their finances because they're supporting them. Then organizational neglect, we said about that with missed calls and self-neglect overlooked until it became life-threatening. So it's almost too late to act now, and then you think, hang on, why wasn't a concern raised much earlier? So one thing to say there is health and social care workers, you don't need proof to act. If you have a concern, the system allows you,
Yeah.
the
You
system
need to
allows you
speak up,
to raise
yeah.
a concern. So the duty is, when you see anything that you're worried about, share it. See it, say it, share it. That was the campaign that was run for many years. But again, it just becomes a buzzword
Yeah.
that people remember from the course. They'll
then
write the test
actually-
and pass it, but in practice, they won't act. So, yeah, those are some of the concerns when it comes to safeguarding, separating abuse and neglect. But they're intertwined. Quite often it's both.
Yeah, as a combination.
Yeah.
Yeah. Okay. Excellent. So some of the last areas I wanted to look at is around sort of workforce competence, because we've said about people need to be responsible for safeguarding, they need to be able to spot red flags, they need to follow some of the policies, and they need to have the platform to do that, which comes obviously from the hierarchy in an organization usually. But if we break down basic competence, even if it's, say, by level, what would your message be on that, so that people understand what their workforce should be able to do, and even then mapping to maybe any training that's going on in the business, so people have the right level of knowledge and education to be able to do their job?
Okay, so I'm going to sound like a broken record here because I say this over and over. Almost every time we talk, we end up talking about workforce development. You have to start with your organizational needs analysis. And then you look at service users that you're going to be engaging with. Then the staff that you need to deliver those services safely, effectively, setting up systems. So once you understand the needs of those people, then you know what risks are there, right? There are some competencies that are required across the board. And these are laid out if you look at the core skills training framework that was done by Health Education England and Skills for Health. And also Skills for Care have similar learning outcomes. The Skills for Health document is a lot more comprehensive, although it's quite outdated, but it does give you a starting point. So there are 3 main levels of training for frontline staff that are required. So at level 1, this is training that everyone must do, right? So the learning outcomes there for people to be able to recognize and report concerns. So they understand what safeguarding is, what abuse is, what it's not, what neglect is, and they understand their responsibility, organizational responsibilities. They understand multi-agency working. So level 1, everyone has to do level 1 training, right? Then level 2 is that ability then to do everything at level 1, but then being able to document and advocate and escalate. So in a typical care environment, say care in the community, domiciliary care or care home, most people will do both level 1 and level 2, right? Then in healthcare environments, generally everyone has to do, like if you're working in NHS trust and GP practice, everyone is expected to do level 2 as a minimum, level 1 and 2 as a minimum. And then those people now that are doing training at level 3, so you're looking at senior staff now, you're looking at registered professionals. So if it's in a care setting, it's the senior carers, the managers, maybe the administrators as well. If you're in a hospital setting, you're looking at all the nurses, you're looking at the doctors, the dentists, all the people that are on professional registers. Why? Because a lot of them are doing risk assessments. Even the most junior nurse is doing risk assessments and documenting, Section 42 inquiries under the CARE Act. And they have to know about multi-agency risk assessment conference. So even if they may not be involved in the day-to-day, they may not be involved in coroners and all that, but they need to know the basic principles. And some of them may be required to attend safeguarding meetings. But it's really crucial because at this point, because you're doing risk assessments, you're doing clinical assessments, you are documenting, and documentation is evidence as well, right? Even for care workers, it is as well. But yeah, so then for safeguarding leads, they would have to do level 4, maybe up to level 5, depending on how big the organization is, and for managers as well, level 4, level 5. But level 1 to 3 are the primary levels for training for frontline staff. And we saw that in the CQC reports we're looking at for organizations that are needing improvement and those that are rated inadequate, many organizations actually had policies in place. Many of them even had training needs analysis done. Many of them had matrices in place. and they had provided the training, but actually those systems were not monitored properly. So you have the structure in place, but you're not actually using it. You ticked a box.
Yeah.
That's what it is. Then also there were failings in, we talk about safe recruitment. So there are certain people that should not work in the care sector. There are certain people that should not work with vulnerable people, and we should be able to weed them out. That is the point of recruitment checks, checking people who have qualifications, their training is up to date, make sure that you get the references, making sure that they've not committed crimes, check their DBS. And and also once those people are in, they're cleared to work, their references are in, you now need to provide induction and onboarding training, right? Part of that is doing the statutory and mandatory training. Part of that then afterwards is the supervision, if concerns are raised, looking at care planning and record keeping, doing lunch and learn when needed, team meetings as well to talk about safeguarding concerns or to remind people what their responsibilities are. And but some organizations were not doing that training. Then once people have done the initial training, they need to do refresher training. So in general, when you look at the core skills training framework, they say that safeguarding training should be done every 3 years. So you do it as part of your statutory and mandatory training on joining the organization. Then you do your refresher every 3 years. In the care settings, they tend to do it more often. Some of them are doing it annually. It's up to you as an organization. You're doing your own risk assessments. You know what services you're providing. You know what risks are inherent in your organization. So you decide. Some organizations insist on doing it annually. But again, if people are going to sit in a room and you spend a day covering 12, 13 subjects, that's not going to cut it.
No, because what's the effectiveness of that is very poor, really, isn't
Exactly,
it?
exactly. And when we started out, actually, we were caught up in that as well. But we realized very quickly, actually, that we can't follow what other providers are doing on the market, and we had to change our system altogether. And for me, it's all about blended learning, a combination of people doing self-directed learning, then maybe instructor-led training, but definitely also work-based learning. Applying those principles within your organization is crucial.
It's crucial, yeah.
Exactly. And managers and supervisors, doing one-to-ones with people, doing team meetings, briefings. There's so much. And again, this is information that we're giving out there publicly without charging anyone. Just give it for free so that people can strengthen their systems.
Yeah. And improve standards, yeah.
Exactly.
So if we look at some of the high-risk areas in 2025, maybe you could just inform the listeners what maybe the top 3 or 4 are right now, even as this year.
Yeah. So again, for me, actually, the key is professional curiosity, right? Even if you're completely new to the care sector, never stop learning. Every day, I listen to the news every day. I don't get much time to watch television, but when I'm driving to the office or going to see clients, I listen to the radio. I listen to podcasts as well. You have to keep learning, and I learn so much because I read about different things. I listen about different things that affect the health and social care sector, and I try to connect things. That's what professional curiosity is about. So to say, look, I'm now working in this sector. I'm a nurse, I'm a doctor, I'm a care worker, I'm completely new. It doesn't matter. Professional curiosity, because quite often we accept explanations at face value. I think that's the biggest problem. So to say, people are lacking professional curiosity, but also organizations are not building systems where people feel safe to report concerns, right? And for us, actually, it's always a good thing to say, okay, I'm not sure what's really happening here. That should trigger something, right? Then that's how concerns come to light. Because if 5 people just ignore, then that's it. That organization, actually, the culture means that people don't see it as their problem.
No.
Safeguarding is everyone's problem.
No, pass the book on to someone else.
Then there are issues, especially for people in domiciliary care, around self-neglect and hoarding. A lot of people now that are in care services, people have multiple problems. Maybe people have, for example, addictions, right? But also, so maybe they are on treatment for that. But or some people are still actively abusing substances and medications and things like that. So it's an area that we're seeing actually growing self-neglect and hoarding. And one of the most common themes in safeguarding adults reviews, where we're failing in our systems actually to provide adequate support for people and also to train our staff adequately. Another issue is around domestic abuse and coercive control. We're kind of, it's almost like we don't expect it when people are older. It's almost like, oh, maybe it's people that are younger will do, right?
Yeah.
But actually, they get older in the end as well.
Yeah, we're all on the same path. Yeah.
Exactly, right? So financial exploitation and scams, they're increasing actually, because even if you look at organizations like Age Concern, they've written some really shocking reports actually, where you're talking
big.
of, we're talking of billions of pounds actually being scammed out of older people, and quite significant number of times is family members that are involved.
Yeah, to do with inheritance and things
Exactly,
like that. Yeah.
exactly. But even using older people to look after children or to get them to pay bills, and you make them feel guilty, and things like that. It's shocking actually, some of the things that we read out there. Then modern slavery, it's hidden in plain sight. And there's a tendency almost to think, oh, that's not going to happen in the UK.
Yeah,
it
happens. That doesn't happen here.
It happens in all these countries where things, people are backward and all that, whatever.
Countries
and people use some language, very colorful language, and you think, well, have you ever thought who is serving you in that restaurant, for example? It doesn't just happen even in car washes. Of course, it happens in car washes, but who is that person actually who is doing your pavement, right? Sometimes actually it's happening in formal businesses, and some people have been arrested, very, very high-profile people who are very rich, but they've got
running big businesses.
Yeah, they've got slaves in their homes, where people work in their homes or in their businesses, and they're not paying them. They just give them enough to eat and to get by from day to day. So modern slavery, sometimes involving healthcare staff themselves. Recently, there was a judge who was doing a PhD at the University of Oxford from another country, and she had brought people working in a home, and one of those ladies was basically a slave. She wasn't paying her. She had taken a passport, and so some of these things actually they happen in plain sight, and it's done by people that you least expect, including healthcare professionals themselves and social care workers themselves. So there's so much. We could spend a day talking about the different types of abuse and neglect. But again, it's about setting the right systems and building a culture where people care. How caring are we? That's one of those areas actually where we look holistically.
How much do you care? But I think it's good for the listeners to see, what areas are on the rise, what things are there to look out for. And like you say, I think those few that you've listed off there are particularly sort of potent in the year 2025, and I'm sure there'll be new things that will come along. Unfortunately, so yeah, I wanted to touch now on hopefully more of a positive stint while we now look at solutions.
Yeah.
Obviously, we're limited with time with this podcast, and again, you could do a whole podcast and thesis really on safeguarding solutions in the UK. But what would be some of your quick sort of tips in a way for business owners, business leaders, or people even working in health and social care in terms of solutions to some of these problems and findings that we've gone through for the majority of the podcast today?
So it's interesting because yesterday I went to an event where I met a lot of business owners and leaders in health and social care. So people from the NHS, people from the private sector, entrepreneurs who are running their businesses in this sector. Most of them have clinical backgrounds, or they worked in social work, and we're talking about these very things yesterday, as you do, and you need to learn from past failures, even if it's not your failures. That's again where that curiosity should come in to say, look, how are organizations failing, so that we can avoid failures ourselves.
We don't want to be that news headline. Yeah.
Exactly, right? So I would start by, if I were running a business right now, or if I'm a manager, registered manager or leader in health and social care, I would start by just doing an audit. Just check your policies, check your safeguarding policy, check the related policies, mental capacity and providing care, actually, people providing intimate care. So all those policies and procedures that you have in place, how up to date are they? Did you do them yourself, or did you just download them from some template and then you just put your logo there? So start by reviewing that, right? And you can also hire someone, an auditor, to come in and do this, but people need to realize that actually they can do it themselves, right? They can do it themselves. So check your recruitment systems. Are you following safe recruitment principles, right? There are clear guidelines on how people should be employed in the healthcare and social care sector, right? You check their qualifications, you check their DBS, you check their references, you verify work history. Don't just take everything at face value, right? Then look at your training. When was the last time you did a training needs analysis? Is your training metrics up to date? So training metrics, we're basically saying we've identified our needs and we're now saying these are the areas, the high risk areas, and this is the training that we're going to provide to minimize that risk, right? And you check the competencies that people need as well, depending on their role and responsibilities. What competencies are needed for the entry level, for the senior staff, for the frontline staff, for the management, check those gaps as well, and make sure you map it. You map the training to the national standards. So if you're in healthcare, the core skills training framework is a good starting point, right? But even organizations like Royal College of Nursing, the GMC, most of these regulators also provide guidance on how people should handle safeguarding issues. And governance is crucial. So look at Regulation 17, the CQC Regulation 17 on good governance. Make sure you're monitoring everything. Make sure that you have a system for people to report concerns and whistleblow as well. You have a whistleblowing policy. And leave it. Don't just put it there. Actually, let it be the culture that, look, we're an open organization, an honest organization. And when people raise concern, we are going to take them seriously and we're going to act on them. Yeah. Right? And so systems as well, we provide systems, and we're not saying we have the best systems in the world, right? But actually, even if you have the best compliance system in the world, if you're not using it,
it's about who's using it, isn't
exactly.
it? Yeah.
And if you're not using it, or you're not using it correctly, then you're wasting your time and money. You may as well not bother. So even if you're using a manual system, as long as you have a system where you get data, you have some sort of dashboard that you can use, everything is in one place ideally, and wherever there are incidents in your organization, be open and honest. Actually, people can report even near misses, learn from them. If you need to retrain people, do that. If you need to update your policy or your procedures, you do that as well. So most importantly, it's about culture, organizational culture, psychological safety, where openness, we have a statutory duty of candor, but if within our organization, we should have candor as well. So say, look, we're open and honest, right? And person-led safeguarding through the principles of making safeguarding personal, because no two safeguarding cases are the same, right? Because safeguarding depends on the person who's receiving care as well, right? What is their situation? Everybody's got different medical history, different social history, different concerns, different wishes, right? So involve the person as well. But for me, those are the key elements really to say, look, start by reviewing your organization, start by checking everything and be honest. I remember many years ago, I was still working in the NHS, where one of my responsibilities, I was in research at the time, I was working in research and development, and one of my responsibilities was to do some audits, just random audits on different wards. So surgical wards, medical wards, even handy. I didn't even need to talk to anyone. I'll just come and look at documents, and then I take a sample. And for those audits, the wards and departments were giving themselves nearly 100% all the time. But when I came in to do those audits, none of them were even getting up to 50%.
Close to 50, close to 100.
So self-auditing, that's some of the challenges actually where we tend to appraise ourselves more positively.
Yes.
Than we should really when we're fooling ourselves. So that's the advantage sometimes of bringing external auditors who are experienced, who know what they're doing, and they'll give you clear action plans. And also listen. When people, I posted about an organization that failed, that were rated inadequate, and they instead of listening to the inspectors, what their concerns were, they were challenging them. Yes, of course, you have a right to challenge, but also listen. Listen to what they are saying, because they have a job to do, and they've given you a rating and a report. Take it, and learn from it.
Learn from it, yeah.
Even now, we're talking about NHS trusts. We're talking about NHS trusts being ranked, and in our region, our trusts have not done well.
There's a nice league table, yeah.
All of our trusts in this region are in the bottom.
They are in the bottom half, yeah. Even Birmingham, yeah.
Yeah, bottom half, and some of them near the end. And it doesn't mean that people don't care in those organizations.
Of course, no. Of course
It
not.
means that there are some failings that we need to address. Of course, these ratings, they presented, it's a double burden in a way, because there's so many hardworking members of staff in all these organizations. But actually, when they're being failed by leadership, when they're being failed by systems, then it demotivates people. Also, it makes people worry, because when you see the headlines, because I saw these headlines on Facebook, on LinkedIn, particularly Facebook, it's very alarming. You sort of think, why would I go to that hospital?
It's damning, yeah.
It is damning.
Because
But
they're this position in the table,
yeah, you think, so should I go there? Then people comment immediately after, and people are commenting. I read those comments actually, because I'm sort of thinking, I want to hear people's honest opinions.
Public perception, yeah.
The majority of them have issues with providers. They're talking about similar things that happened to mid staffs. Then some people are also saying, I got excellent care. And I'm one of those people that got excellent care in these trusts that are now ranked at the bottom. But I've also got some concerns as a patient. And I did raise them, because when I was admitted, I filled in my feedback to say, yeah, I was happy with this, and that. I was happy with the operation, this was done, but I wasn't happy with this, and that. And I'm hoping that they'll take that.
They've read it and they're learning from it.
And learn from it, right? So no organization is going to wake up one day and just be rated inadequate just like that. It takes time. And then during that time, it depends on the systems that we're building. It depends on the culture that we're building. And safeguarding is one of those things that is so human, isn't it? It's human factors. How you feel about me could lead to a safeguarding issue.
It could, yeah.
How I'm feeling that day, my own problems, I come to work, or how I'm feeling about my colleagues or my manager, I can pass them on to a patient or a service user in a care setting. So for me, it's one of those topics that perhaps for us, I'm surprised we took so long to talk about it. When I used to teach in clinical environments and at the university for the healthcare side, and even in management, when I was teaching management, I always used to use these case studies. You're teaching people that are doing MBA, international health or healthcare management. I'd bring these case studies, mid-staffs, Winterbourne View, Baby P, these real case studies actually, to look at them, to teach people to say, look, healthcare is not just about managing budgets and in private sector, it's not about profit. And the NHS Trust is not about gobbling up all these hospitals together. It's about actually thinking about the capacity that we have to deliver safe services. Sometimes we're overcommitting and we're taking more than we should.
And we should, yeah.
Yeah, and it results in people being harmed needlessly. And it's a concern. It's a real concern. And I think we should keep talking about this and maybe even invite some safeguarding experts as well.
Yeah, it's definitely on our radar. I think even the marketing team would like to do a month or two where we just focus on safeguarding. We talk about safeguarding a lot. And we use our platform to not necessarily raise awareness. I think a lot of the awareness is there, but some of the information regarding safeguarding and looking at solutions as well. We want to be as positive as we can and look at positives and look at outcomes. We don't want to dwell. Obviously, you have to review some of the things that have happened, the case studies, the reports that come out, the news headlines, but what can we do to improve in the future?
Yeah.
So yeah, excellent. Thank you very much for that, Richard. Just a quick update for listeners. We have recently updated a batch of our safeguarding courses. So if any of you go on the website now or you're accessing your account, you'll see actually the recent safeguarding courses have been fully updated. And as Richard hinted at earlier, we will be offering some toolkits in this area that will be available for free from the website, from links on social media. So download those toolkits. They'll be available in your account once you fill in the information. and try and make use of them and give us some feedback. What could we add? Were they useful? If you've got any user cases or case studies or testimonials to send us, that'd be much appreciated as well. And also any other ideas on how companies like ours that are in the compliance space, how can they help you with safeguarding? It might not just be about training. What other things could help safeguarding in your setting? Like we said, whether it's a care home, whether it's a hospital, a GP practice, whether you're running a domiciliary care organisation. So I think that's it from us. Any closing remarks, Richard?
Yeah, look, what I'll say is safeguarding is the foundation of everything that we do. It goes to, it covers so many laws. It's not just the Care Act. We're talking about the Human Rights Act. We're talking about the Equality Act. We're talking about the principles of dignity and respect, trust, the duty of candor, the duty of care. And like I said, it's not that we don't know these things. People have done training over and over again, but remember, it's a legal duty as an individual, as an organization. So it's a regulatory requirement, and it's a moral imperative as well, from one human being to another, treating each other with kindness, with dignity, with respect. If it's done well, it protects people's lives. They'll live happier, longer lives. And if done badly, it costs them. We've seen people being harmed seriously. We've seen people deteriorating. We've seen people dying, right? So it sounds like we're being alarmist. No, we're not, right? There are many organizations out there that are rated good and outstanding, that are providing excellent care. But even for them, they can't afford to be complacent, right? We need to maintain systems. We need to keep educating people. We need to learn continuously whenever there's concern, even if it's a near miss. We need to use it to learn real examples from our own organizations, because training is done sometimes once a year or every 3 years, but safeguarding is done every day.
Yeah,
you don't wait for 3 years.
No.
If there are opportunities to learn. Like I said, I listen to the news. I read newspapers. I talk to people. I try to learn all the time, because the job that I have to keep learning, right? Although I'm not in the front line anymore, but I work with people that are providing frontline services, and I want to make sure that when we are advising them, we know what we're doing.
Well, exactly,
right?
yeah.
But also, if it's your duty to provide frontline services, you have to learn a lot, because there's so many other things you have to connect. But anything, think about it, whether it's resuscitation, safeguarding can be an issue. Infection prevention control, safeguarding is there. Moving and handling, safeguarding is there. A risk assessment, care planning, safeguarding is there everywhere. Right? And it's never far away. So for me, it's actually probably the core regulation, really. If it fails, then there's nowhere to go. It's not a safe organization.
Everything
That's
else
it.
can fail,
Yeah. But like I said, there's so many organizations that are providing excellent services to learn from. What we're going to also be doing is to look at the organizations that are good and outstanding. What is it that they're doing so well?
Yeah.
That the ones that are failing could learn.
Need to learn from, yeah.
It's not that we're geniuses at all. No, we're just looking at the reports, and we want to use them to educate others and give that information out so that people can make up their minds where they want to be in this rating. Rating alone, it doesn't define how good we are. It's just done at a particular time. We need to live it. Safeguarding something that we live every day.
Yeah. Excellent. So thank you again for listening, and we'll be back next week to discuss another very important topic.
Yeah.
Thank you.
Fantastic. Thank you.